Welcome to Reform Thinking and our show, The Deep Dive. This is where we take all your sources, articles, research, even your own notes, and we try to distill them into the insights you really need. Our goal is always to give you a clear understanding of big topics, maybe with some surprising details along the way. Today, we're diving into something truly pressing, the work to rebuild Ukraine's healthcare system. You know, when you look at the bare facts, the destruction, the human cost, it's easy to feel, well, overwhelmed. But beyond those headlines, there's a detailed plan being drawn up. And it's one that seeks not just to repair, but really to reshape things for the future.
Indeed. And this isn't merely about logistics or infrastructure, you see. It's a project with a specific guiding theological framework behind it. Our material today comes from various places, reports from the World Health Organization, analyses of historical evidence, and papers that draw a clear line from Reformed theological thought to very practical solutions on the ground.
Okay, so our mission today is to unpack this intricate strategy. We'll look at Ukraine's healthcare before the war, the devastating impact of the conflict, and then, and this is really interesting, how a biblically informed approach provides the guiding structure for its revitalization. We'll look at the specific stages of rebuilding, the obstacles they anticipate, and how solutions are being crafted, even drawing on lessons from other nations. Here's where it gets really compelling. Okay, let's start by maybe getting a handle on where Ukraine's healthcare system stood before the recent large-scale conflict. What was the baseline?
Right. Well, prior to 2014, Ukraine inherited what was called a Samashko-style hospital-first system from the USSR. Basically, it meant care was nominally free and widely accessible, but it was mostly concentrated in these large, city-based inpatient institutions.
So big hospitals were the main focus, rather than, say, local clinics.
Exactly. Imagine if almost everything funneled through a major hospital. And to give you some numbers, back in 2000, Ukraine had about 950 hospital beds per 100,000 people. That's quite high. But this model became financially unsustainable. The economy contracted, and people ended up paying a lot out of pocket anyway, informally.
Oh, so the free system wasn't really free in practice.
Not entirely. And as state funding couldn't keep up with costs, bed numbers and staff dwindled. By 2019, capacity was down to around 665 beds per 100,000. Now, the medical workforce itself wasn't bad by regional standards, about 417 physicians per 100,000, but it was unevenly spread and, crucially, poorly compensated.
Okay, so a system already under significant strain even before recent events. What actually sparked the efforts to modernize it?
The Euromaidan revolution in 2014 really created the opening for a thorough overhaul. Reformers saw healthcare as a vital area to dismantle these entrenched patronage networks and align Ukraine more with EU standards.
What were the specific problems they were targeting?
They focused on opaque budgeting, where the money wasn't clear, this hospital-centric delivery model, and as we mentioned, those pervasive informal payments. Then, in 2017, a key piece of legislation was passed. The Law on Financial Guarantees for Healthcare Services. This established the legal basis for separating the purchaser, the government, essentially from the provider functions in healthcare.
Trying to make it more transparent who pays for what.
Exactly, and aiming for clearer benefits for patients.
This sounds like significant groundwork. What were the early results of these reforms? Did they see improvements?
The results were actually quite encouraging initially. By December 2021, so right before the full-scale invasion, over 30 million Ukrainians had chosen a primary care physician. That's a big shift towards patient-centered care.
So people were engaging with this new primary care model.
Yes. And health spending had risen to just over 8% of GDP, which was getting closer to OECD averages for similar economies. That's a substantial increase. Hospital rationalization continued, bed numbers went down further, and underused facilities were being repurposed as outpatient or rehabilitation centers, more efficient use of space.
Okay.
And importantly, digital contracting seemed to help reduce some of the small-scale corruption, making payments more traceable. Plus, maternal and infant mortality rates saw a slight downward trend.
That's definitely progress. But were there still cracks in the system? It sounds like it wasn't perfect yet.
Oh, absolutely not perfect. Yes, significant weaknesses remained. Rural clinics often lacked suitable equipment, meaning access was still an issue outside cities. Specialist care was still dominated by these very large regional hospitals, the oblast hospitals. And maybe most telling, nearly half of all healthcare spending still came directly from people's pockets.
Wow, half. So high personal costs were still a major factor.
A very major factor. It could lead to really high financial burdens for families facing serious illness.
Then, February 2022, the full-scale invasion hit. What happened to this evolving, reforming system?
Well, it reversed many of those gains very, very quickly. The scale of the assault on healthcare itself has been, frankly, shocking. The World Health Organization has verified, and these are verified cases, over 2,254 deliberate attacks on healthcare facilities, ambulances, patients, and staff since the invasion began.
2,200.
Yeah.
That's the highest recorded tally in any modern conflict.
Yes, the highest. And these incidents are still being logged weekly, even now in 2025. Independent analysts estimate nearly 1 in 10 hospitals has been damaged or destroyed. Think about frontline regions losing entire surgical areas, diagnostic labs, maternity wards. It's devastating.
And the human impact beyond the buildings.
Immense. Thousands of clinicians have been displaced outside the country, creating huge staffing gaps. Supply chains for vital things like medications and blood products have been broken. And intermittent electrical outages, they've crippled intensive care units. Imagine relying on life support when the power cuts out.
Just unimaginable. A grim picture indeed. But you mentioned earlier something about resilience. What endured through all this?
Yes. What's remarkable is that the reform architecture itself largely held up. The National Health Service of Ukraine's digital backbone, the system for registrations, payments. It continued to process emergency payments.
So the underlying digital system kept functioning.
It did, and its capitation model, paying doctors per patient, proved adaptable. It allowed funds to be redirected quickly to mobile clinics, to telemedicine, reaching people where they were. And it's this unique situation, prior progress meeting wartime devastation, that really shapes the current effort. The goal isn't just rebuilding to what was there before,
But reshaping it.
exactly, reshaping it into a system that can withstand future shocks and, critically, always respects human dignity.
Okay, so connecting this to the rebuilding strategy.
Yeah.
Our sources talk about a plan that weds public health science with distinctly reformed theology. How does that work? It seems like an unusual pairing to some.
It might seem unusual initially, but what's compelling here is how Reformed theology frames every social effort by asking these fundamental questions. Who is God, and what is our standing before him? Scripture makes it clear that God creates, sustains, judges all things, and crucially, that human beings alone bear the imago Dei, the image of God. That concept becomes the bedrock.
Right, the imago Dei. Let's start there. What does that imply specifically in this context of rebuilding healthcare in Ukraine?
Well, because each person is seen as a living image of the Creator, the destruction of Ukrainian bodies, of hospitals, isn't just a geopolitical crisis or collateral damage. It's viewed as an assault on divine artistry. The sources even point out that blood spilled on clinic floors cries from the ground, echoing Genesis. So any rebuilding effort that ignores this created dignity or just treats patients like economic unit
Would be missing the point, spiritually speaking.
it would be a spiritual failing, exactly. Regardless of how many buildings get repaired or machines replaced, the key insight is that healthcare is elevated. It becomes an act of honoring God's creation in each person.
And this inherent worth, you mentioned it's guarded by the sixth commandment, you shall not murder.
Negatively, yes, but also positively, by the duty to preserve life. The Westminster Larger Catechism, for instance, question 135, requires believers to engage in all careful studies and lawful endeavors that protect human flourishing. So this means things like public health science, trauma surgery, epidemiology, logistics, even hospital architecture. They aren't just secular fields. They're seen as avenues of Christian obedience.
So doing good medicine is an act of obedience.
Precisely. They're not optional extras. They're the very shape that neighbor love takes when missiles are falling. It pushes back against any view that limits mercy to purely spiritual activities and ignores practical medical needs.
Okay, so medical care itself as obedience. Now this leads to that other idea you mentioned, sphere sovereignty. How does that play out practically here?
Right, sphere sovereignty. It's often linked to Abraham Kuyper, but it has roots in passages like Romans 13. The core idea is that God ordains multiple overlapping jurisdictions, family, church, state, market, etc. Each is accountable directly to God, but they're forbidden from overreaching or controlling the others. They have distinct roles.
So in post-war Ukraine, what would those distinct roles look like in healthcare rebuilding?
Well, for example, only the civil magistrate, the state, has the authority to negotiate safe passage for medical convoys or wield protective force. That's its God-given role. Only the church communicates Christ, administers sacraments, exercises spiritual discipline. Private firms innovate and generate medical solutions, vaccines, software. Civic nonprofits mobilize volunteers for things like transport or basic aid.
And keeping these roles distinct is important.
Very important. It guards against the state becoming totalitarian or the church trying to run the government government or the market. It allows for cooperation without confusion, respecting the boundaries God has set.
Okay, that leads logically to stewardship. If these different spheres are operating, how does reformed thinking apply to allocating the funds and resources needed for this massive rebuilding effort?
Stewardship is absolutely core here. Psalm 24.1 says, "The earth is the Lord's and the fullness thereof." So, money allocated for rebuilding hospitals. It's never truly just public money in the sense of being ownerless.
It's seen as God's property, entrusted to us.
Exactly. Entrusted property, divine property on loan. And this perspective creates a really strong moral imperative for how it's handled. The Westminster Confession, for example, says, "Good works must be done in obedience to God's commandments and for the glory of God." So practical things like paying contractors promptly, having public financial audits, tracking pharmaceuticals via blockchain, protecting whistleblowers, these aren't just good governance ideas.
They're ethical requirements.
Yeah.
Christian ethics in practice.
Yes. They are Christian ethics applied directly to finance and administration, and corruption, therefore, isn't just mismanagement, it's seen as theft, a violation of the eighth commandment, harming the common good.
So beyond financial integrity, what's the church's specific role in this framework?
The church has a diaconal mandate, a call to active mercy and witness. Think of the Good Samaritan. He bandaged wounds, paid for care. His actions spoke volumes before any words about faith might have been exchanged. So congregations converting basements into triage posts or volunteers driving insulin across dangerous territory. They're making the invisible kingdom visible. They adorn the gospel, as Titus 2 says.
But it's not just practical aid.
No, the sources stress a balance. Practical aid alone, without offering the gospel, would be incomplete. It would address physical needs but neglect the deeper spiritual ones. So chaplains, pastors, evangelists are called to be alongside medical staff, offering scripture, prayer, the hope of resurrection to both staff and patients. It's holistic care.
Now, you mentioned something called cessationist sobriety earlier. Can you unpack that a bit in this context? What does it mean practically?
Right, cessationist sobriety. It's a distinct contribution from many within Reformed thinking. It means that while we absolutely believe God can heal instantly, and we pray fervently for that mercy, we don't believe the miraculous sign gifts seen in the apostolic era, like guaranteed healing on demand, are the typical way God works today.
So a more measured approach to claims of miracles.
Exactly. And practically, this guards vulnerable people from charlatans who might promise cures for money or faith. It redirects energy towards the ordinary means God usually uses to bring blessing.
Which includes?
Skilled doctors, evidence-based medicine, reliable medical supplies, good nursing care, and always fervent prayer alongside those means. Pastoral teams focus on teaching people how to lament, how to grieve, encouraging appropriate medical treatment, and resisting any kind of over-promising about guaranteed deliverance or misinterpreting every recovery. It's grounded.
Grounded, yet hopeful. That seems to be a theme. How does future hope, eschatological hope, connect with these very earthy, practical rebuilding efforts?
That's the final crucial piece. The entire undertaking is fueled by eschatological hope, hope in Christ's return, and the final restoration. A rebuilt hospital ward, no matter how modern, is still ultimately temporary. It's a shelter until the day Revelation speaks of, when the leaves of the tree are for the healing of the nations and death itself is finally defeated.
So this future hope prevents utopianism,
Yeah.
thinking we can build a perfect system now.
Precisely. No human policy can bring about God's final kingdom. But this hope fuels perseverance. It gives meaning to the struggle. Every medical procedure done faithfully, every bit of infrastructure rebuilt ethically, anticipates that ultimate healing. So Reformed theology provides the motivation, the ethics, the organizational framework for a healthcare revitalization that aims not just to mend war's injuries, but also to offer a living witness to the King who binds up the brokenhearted.
Okay, so taking that theological framework, how does it translate into a concrete, practical plan on the ground? Our sources outline a three-phase pathway. Let's break down phase 1, immediate relief, the first 6 months.
Right. Phase 1 is all about immediate survival and stabilization. Keep people alive, stabilize the life support systems of society. It's a direct response to those ongoing attacks we discussed. This means deploying WHO standard emergency medical teams, setting up expandable field hospitals, using armored, blast-resistant surgical tents near the front lines.
Things that can function under fire, essentially.
Yes, and protecting ambulances, medical evacuation trains, maybe with Kevlar sheathing, electronic ID transponders, because growing drones are actively targeting them. And here, sphere sovereignty helps clarify roles again. The state arranges safe passage. Military chaplains provide spiritual support. Local churches offer volunteers for practical tasks, stretcher bearing, providing meals.
Like Nehemiah's builder's tools in one hand, protection in the other.
Exactly that image. Acting with discernment, using ordinary means, but seeking divine protection.
Makes sense. How do they even begin to assess the damage and needs in that kind of chaos?
That's a huge challenge. A rapid, thorough assessment is crucial. The plan suggests that within 30 days, a joint Ministry of Health WHO task force should restart something called the HRAMS assessment. This involves using satellite imagery overlaid with existing e-health data to map every facility functional, damaged, destroyed.
And involving the community.
Yes. Parish networks, local churches can help verify this ground truth, taking photos, uploading geotagged reports. It's practical neighbor love, respecting the distinct roles church provides info, state uses it for planning. And transparency is key. Public dashboards updated in real time, fulfilling that stewardship ethic, guarding against those old informal payment systems.
And supplies. Getting vital medicines and equipment where they're needed must be incredibly difficult.
Absolutely critical. Frontline care is useless without antibiotics, blood products, and anesthetics, and keeping things cold during power outages is a nightmare. So Phase 1 designates 3 western regions, Lviv, Ivano-Frankivsk, Zakarpattia as major warehousing hubs, linked to rail lines connecting to Poland, Romania, etc.
Strategic locations, further from the front.
Right. And each hub needs secure, temperature-controlled supply routes, maybe using independent generators or solar for refrigeration, all tracked by blockchain for accountability. Every pallet's chain of custody monitored. Local congregations can even act as last-mile distribution points when the grid is down. We've seen international charities already proving this model works.
Digital transparency, again, helping maintain trust.
Yes, helping the state stay accountable to donors and taxpayers.
And then the spiritual and psychological side, even in this immediate phase.
Crucial. War wounds the soul, not just the body. The WHO warns of a huge unmet need for trauma counseling, rehabilitation. We're seeing increases in depression, PTSD, substance abuse across all ages. So a tiered response starts right away. On the streets. Trained deacons, volunteers providing psychological first aid listening, stabilizing, using scripture's language of lament and hope.
Basic support, immediate presence.
Yes. Then mobile mental health teams, psychiatrists, pastoral counselors follow up quickly, within about 72 hours. Encrypted platforms allow remote consultations from clinicians outside Ukraine, too. And that reformed emphasis on ordinary means guards against exploitation, focusing efforts on skilled practitioners, evidence-based methods, and gospel comfort.
Okay, that covers the first 6 months immediate crisis response. What happens in Phase 2? Transitional rebuild. This covers 6 months to 2 years out.
Phase 2 shifts gears. It moves from just stabilizing to actually building resilience through sustained, focused effort. The guiding idea here is repairing the ruins, thinking long-term but acknowledging ongoing danger. It means coupling a high appreciation for risk with confidence in God's common grace working through structures, networks, resources.
So hardening infrastructure is key.
Definitely. Strengthening and decentralizing physical structures. We're already seeing things like EU-funded modular clinics with shrapnel-resistant walls. They're operational. Installing microgrids is another example. A rebuilt surgical block running on its own rooftop solar and battery array, providing autonomy during missile-induced blackouts.
That's practical resilience.
It is, and from a reformed perspective, these aren't just cost-saving measures. They honor the sixth commandment by shielding life. They show sphere sovereignty in action. State regulators ensure safety, private firms provide tech, church volunteers might help with non-specialist tasks like cleaning or basic setup. Distinct roles working together.
And the supply chain development, how does that evolve?
It continues to be critical. Those western regions keep developing as logistics hubs, building specialized cold chain warehouses. Ukraine's vaccine network is becoming one of the most advanced in the region because of this. International organizations are already helping establish transport corridors from these depots to frontline pharmacies, showing how non-state actors can fill gaps the state can't yet secure.
Blockchain tracking continues.
Yes, tracking every shipment, turning financial records into stewardship accounts, and there's also a focus on medical waste management training staff to handle infectious refuse properly. That protects public health, prevents misuse of resources.
A really critical issue is people and the healthcare workers. What's done in Phase 2 to address the brain drain and burnout?
Human resources are absolutely vital. We mentioned maybe a quarter of clinicians have left. Those remaining are exhausted. This is where the global church can really step in, bearing burdens. We see programs arranging for Ukrainian surgeons, oncologists to get further training abroad, but with a clear commitment to return and practice in Ukraine for a set period.
So upskilling with a requirement to come back.
Exactly. And parallel scholarship funds supporting rural medical students tied to agreements for them to practice domestically. If they don't, they repay the loan. It blends aid with accountability. Inside Ukraine, family medicine training programs are restarting, using combined sites, rotating interns between functioning clinics in the West and rebuilt hubs in the East. It helps reconnect the profession.
And broader public health initiatives, can they get back on track?
Yes, with facilities becoming more stable and staff returning, wider efforts can restart. Immunization coverage, which dipped significantly for measles, has already shown recovery thanks to things like mobile vaccine buses and better cold chains reaching remote areas. Phase 2 scales this up nationally. It combines surveillance for things like waterborne diseases, cholera watch, with task forces monitoring antibiotic prescribing to manage resistance.
And the church's role in this?
Because Scripture links physical well-being with faithfulness, churches willingly offer their halls for temporary vaccination clinics. It's practical neighbor love, tangible action.
Digital security remains a concern, I imagine.
Hugely important. Ukraine's e-health platform works, but cyber reports show constant attempts malware, ransomware targeting hospitals, blood suppliers. So Phase 2 funds a zero-trust security upgrade. Isolating devices, multi-factor authentication for all clinicians, backing up data securely in other countries.
This secure network enables other things, too.
Yes, like those remote consultations for people in occupied areas, allowing specialists anywhere to read scans quickly. From a theological view, this digital protection is part of the government's duty to do good and protect the innocent, just like physical security.
So at the end of this 2-year transitional phase, what does success look like? What are the key markers?
Success isn't just about new buildings. It's measured by real indicators. A significant drop, say 70%, in operating room power outages. Vaccine shortages halved. A large number, maybe 40,000 remote teleconsultations logged. And crucially, every hryvnia spent traceable on a public ledger. These aren't just stats. They're seen as visible acknowledgments of God's preserving mercy. And they set the stage for Phase 3, moving from coping to actively improving the system.
Which brings us to Phase 3, strategic system build-out. This is the long view, 2 to 10 years out.
Precisely. This is moving beyond crisis mode into a decade of deep organizational repair. The goal is to make Ukraine's health sector permanently resilient, ready for ongoing security risks, and aligned with EU standards. The cornerstone here is an integrated national network for trauma care and rehabilitation. We're already seeing pieces of this private initiatives opening large rehab centers with advanced tech like VR-assisted gait labs, government programs delivering prosthetics.
So building on existing efforts.
Yes, scaling them up. Over the next 10 years, the plan is to link these facilities with 2 national reference hospitals, maybe one in Lviv, one rebuilt in Kyiv, creating a hub-and-spoke system. This network needs to handle the estimated 100,000 amputation cases from the conflict. These hubs would also become major training centers for specialists in prosthetics, occupational therapy, and importantly, spiritual counseling, whole-person restoration.
And mental health in this long-term strategy, how is that integrated?
The National Mental Health Action Plan and a new coordination center expand that 3-tiered system we talked about. Community level, basic support from local leaders, nurses, mobile teams, handling complex trauma, residential care, regional unbroken houses for survivors of torture captivity. The theological rationale is clear. The imago Dei requires holistic renewal, body, mind, spirit, and sphere sovereignty ensures church care complements, doesn't replace medical functions.
Makes sense. Now, for a decade-long project, governance and finance are absolutely critical. How is that managed?
You need a robust framework to resist corruption and donor fatigue. The proposal is for a National Health Reform Commission accountable to Parliament, but monitored by an independent ethics board, including theologians, patient advocates, data auditors. Funding is increasing World Bank loans, EU packages, but there's still a huge gap. The estimated rebuilding cost is vast, over $500 billion total, with maybe a $10 billion health gap just for 2025.
How do they bridge that gap ethically?
Radical transparency. Every contract on a public blockchain ledger. Quarterly forensic audits published openly. This makes the idea that the earth is the Lord's into practical accounting. And alongside big loans, you have church-led initiatives, Jubilee funds clearing medical debt for war-affected families, low-interest loans for rural clinics. It combines careful stewardship with active mercy.
And finally, measuring success over this decade. How do they track progress beyond just outputs?
Measurements need to inspire appreciation, tell a true story. By year 10, the aim is a dashboard showing things like that 70% drop in ore power outages maintained, prosthetic waiting times under 60 days, widespread outpatient mental health coverage in every community, and a patient dignity index.
Patient dignity index.
Yeah.
Based on
Anonymous patient surveys tracking respect, privacy, access to spiritual care. These indicators would be displayed publicly on government and church websites, turning data into acknowledgement. Success isn't utopia, it's pilgrim advance. Each step forward is a practical prayer for that final healing. The resilience built in modular design, independent power shows wisdom whether peace holds or challenges return. It completes the arc from aid to lasting wellness, with state, market, and church as connected custodians.
this plan sounds remarkably thorough. But as you said, rebuilding during an ongoing conflict, the obstacles must be immense. What are the biggest ones, and how does this reformed approach tackle them?
You're absolutely right. The obstacles are formidable. First and foremost, the continued attacks. Hospitals, clinics, ambulances deliberately targeted, drones hitting medical transport. The rate isn't decreasing. The reformed response is practical realism. Back to Nehemiah's builders. Fortify sites, blast walls, backup power, dispersed triage centers, layered protection. Churches provide trauma kits, prayer, volunteers, treat like it's precious, something to be guarded.
Another huge one has to be money fatigue, both internationally and maybe even domestically.
A very real concern. That funding gap is huge. Ukraine's budget relies heavily on external aid. Donor attention shifts, headlines change. So Reformed churches are called to model joyful, sacrificial giving like the Macedonians Paul wrote about, setting up funds for medical debt relief, transparent crowdfunding platforms, long-term commitments. It signals that this isn't just temporary sympathy, but enduring support.
And with large sums of money, inevitably comes the risk of corruption. How significant is that threat?
It's a persistent concern. Studies warn reconstruction deals are high risk for fraud, especially in public health procurement. Reformed ethics counters this with radical openness sunlight. Blockchain for contracts, public audits, citizen oversight portals, maybe run by theological schools, training students in forensic analysis alongside theology, make faithfulness operational.
The human element, again, losing healthcare workers, that drain must be a massive hurdle.
It is. Staffing gaps, burnout for those who remain. It's critical. A reform solution blends effort with rest, getting clinicians abroad to commit to periodic returns, supporting rural students who agree to stay, and importantly, scheduling regular silence days or retreats for frontline staff. Treat burnout as preventable harm, not a badge of honor. It echoes Jesus telling the disciples to rest.
And the digital battleground. Cyber attacks seem like a constant invisible threat.
They are. An ICU can be disabled by malware just as effectively as by a missile. Thousands of cyber incidents targeting critical infrastructure, including hospitals. Sphere sovereignty again helps here. The state secures national networks. Private tech firms patch vulnerabilities. Churches teach digital hygiene strong passwords. Encrypted communication as part of obeying the 8th commandment against theft. Cyber stewardship is neighbor love now.
Finally, what about those quieter issues, maybe mistrust between secular and faith groups, or just sheer exhaustion and despair among the people?
Yes, planners have to address those too. Some NGOs might worry about proselytizing. Some believers might be tempted towards resignation after so much loss. The biblical answer is clear. Do good, that they may see your good deeds and glorify God. Clear agreements, MOUs, define where spiritual counsel ends and medical care begins. Churches use lament psalms to channel despair into endurance. Rotating volunteers, debriefings, gratitude gatherings help sustain communities.
So the message seems to be, acknowledge the huge obstacles, but the theological framework offers practical ways to address each one.
Precisely. Each obstacle could derail the effort, but none needs to. Reformed theology provides the clear-sightedness to spot dangers and the principles to meet them: discernment, generosity, honesty, rest, protection, visible good deeds. Turn obstacles into opportunities for witness.
That makes a lot of sense.
Yeah.
Now, what's really interesting is that Ukraine isn't starting entirely from scratch in terms of ideas. Our sources mention wise plundering, learning from others who faced similar rebuilding challenges. What examples come up?
Right, wise plundering. It's about learning from communities, nations that have successfully rebuilt healthcare out of conflict or poverty. It's not reinventing the wheel. Four key examples stand out.
Okay, let's take the first one. The Netherlands after World War II. What's the lesson there?
Post-WWII, Netherlands faced ruins, an empty treasury. Dutch society was famously pillarized, distinct Protestant, Catholic, socialist, liberal communities. Each rebuilt its own institutions, including many reformed hospitals. Historians note that reformed leaders explicitly used Kuiper's sphere sovereignty ideas. They insisted charitable medical work stay under Christian direction, but accepted state financial aid based on clear terms.
So maintaining distinct identity while cooperating financially.
Yes. And by the 1950s, these hospitals were coordinating purchasing, setting up insurance funds, negotiating transparent payments, laying groundwork for the modern Dutch system. The lesson for Ukraine is that decentralized, faith-based facilities can thrive alongside a national system if agreements focus on outcomes and finances are open. Diversity fosters resilience.
A strong example of principled pluralism. What about retaining medical talent? That persistent brain drain issue.
For that, look at AIC Kajabi Hospital in Kenya. They faced a similar challenge. Since 2008, Kajabi runs highly respected surgical training programs, like PACS, for Christian doctors, accredited by African institutions. They have an on-campus simulation center, reducing the need for costly overseas fellowships. And crucially, an explicit discipleship curriculum prepares graduates for service, often in rural mission hospitals.
Does it work? Do they stay?
Studies show a very high retention rate, over 80% practice regionally long-term, often in hard-to-staff areas. So the Kenyan template for Ukraine is build high-quality, accredited, Christ-centered training at home, connect it globally, integrate spiritual formation so doctors stay for reasons deeper than just salary.
Grow your own, anchored in purpose. Okay, what about reaching large rural populations, a perennial challenge?
The Christian Health Association of Malawi, offers insights there. The STAM runs a network of 175 mostly rural facilities. They provide about 30% of all Malawi's health services and train up to 80% of its clinicians. They do this through government agreements, service-level agreements that cover user fees for the poor, allowing access. The key is carefully written agreements that preserve Sham's Christian identity while demanding transparent financial audits.
So clear contracts, protecting identity, but ensuring accountability.
Exactly. It's a blueprint for Ukraine's Health Reform Commission on how to draft MOUs that allow church-state cooperation without triggering suspicion or compromising mission.
And the final example sounds particularly poignant: post-genocide Rwanda and mental health.
Yes, Rwanda provides a sobering but ultimately hopeful precedent. After 1994 devastation, hospitals destroyed, clinicians dead or fled. Yet, by 2024, massive improvements in health indicators, a strong community health worker program. Faith-based organizations were pivotal. They owned a large share of facilities pre-genocide and were central in rebuilding clinics and staffing trauma counseling centers. Rwanda's mental health approach now integrates village peer support with specialized psychiatric care.
What's the key takeaway for Ukraine from Rwanda?
It shows that widespread spiritual and psychological healing is possible even after immense trauma, especially when churches embrace evidence-based therapeutic approaches alongside spiritual care, rather than relying solely on unsupported claims of quick fixes.
So pulling these examples together, what are the core strategies Ukraine can learn from this wise plundering?
5 key strategies emerge. 1. Keep ownership varied. Dutch, Malawian examples show diverse providers build resilience. 2. Ensure openness in every agreement. Financial transparency builds trust. 3. Grow your own workforce. The Kenyan model boosts retention. 4. Integrate mental health from day one. Rwanda shows trauma must be addressed concurrently with physical rebuilding. And 5. Sanctify practical efforts with prayer and purpose. All these models blend careful planning with clear spiritual aims. They prove that a robust theology of human dignity embraces practical tools, ledgers, solar panels, simulators. If Ukraine applies these lessons, it can truly turn destruction into functioning hospitals, committed professionals, and communities testifying, like Joseph, that even through suffering, God intended it for good.
That really is a comprehensive deep dive. It's so clear that this reconstruction in Ukraine isn't just about bricks and mortar or bandages and beds. It's a deeply intentional effort, guided by, well, foundational principles.
It really does highlight how different parts of society, policy, private initiative, personal giving, church action can all contribute to a larger vision of healing and restoration. And the idea that every action, from a complex surgery down to how you manage the finances, can actually reflect a theological outlook. That's quite something to consider.
Absolutely. The vision laid out here for Ukraine isn't just about fixing what's broken by the war. It seems aimed at building something more resilient, maybe more integrated, and perhaps in that spiritual sense you mentioned, more complete.
It makes you think that this whole rebuilding effort, with all its immense challenges, isn't only about meeting immediate needs, it's also serving as ongoing testimony, a visible expression of hope for a greater ultimate healing that is still to come, a kind of down payment on that future reality.
So, thinking about all this, what does it mean for you listening in? Maybe it prompts some reflection on how foundational principles shape our own actions, even in really difficult circumstances. Perhaps it suggests ways different parts of our own societies could collaborate more effectively for the common good. Or maybe it simply stirs thoughts on what hope and rebuilding really mean when faced with such widespread destruction and suffering. We encourage you to consider how these ideas, these principles, might resonate or apply in your own spheres of influence.